what my philosophy has become with opioids is that it's really about choosing the right patient. So a lot of the guidelines are kind of clumping everybody together, and you should reduce to this certain amount. There's controversy about the MEDDs. There's no set guidance or like universal standard for converting to morphine equivalent daily dose or MEDDs. So there's even controversy around that number that has been chosen by guidelines. But regardless of that, for me, it's about choosing the right patient, because not every patient will benefit from opioids. And sometimes you have to try opioids to really see if someone will have benefit with them. But if this patient's exhibiting, red flag type behaviors or concerning behaviors that you think makes them not an appropriate candidate for opioids, then you should taper them off or just not even pursue the opioid route. But for me, I think the most important thing in place, besides choosing the right type of patient for the opioids, is making sure you're offering them the alternative treatment. So non-opioid pharmacologic agents, but also non-pharmacological treatments. But we've discussed it, and sometimes there's limitations with that too, depending on where the patient lives, insurance coverage, things like that.
I would kind of concur with what Abby said. I find that my role is less and less initiating or starting opioids in patients, but more focusing on trying to optimize non-opioid medication options for patients, and then also having time to have that discussion about other non-pharmacological approaches and self-management techniques, and really talking about the things that have shown great benefit, like exercise and behavioral health, like CBT for chronic pain. So I spend a lot of time with my patients discussing those other approaches to managing pain, and then try and refer them to those resources. And what I try and tell my patients is what we find, at least, is that the patients who are open to receiving treatment from different approaches and modalities, that when we use a team approach and combine lots of different methods of managing pain, that those people often do better. So that's kind of where I'm finding my role being lately.